Hi, my name is Sabrina Manjuri, and today I'm going to be talking to you about celiac disease and how it affects the exercise response. So what exactly is celiac disease? Celiac disease is an autoimmune condition that is characterized by small intestinal mucosal injury and nutrient malabsorption in genetically predisposed individuals in the response to the dietary ingestion of wheat gluten, as well as similar proteins that are found in barley and in rye. So, celiac disease was predominantly classified as this immune reaction to these gluten proteins called prolaminins. Prolaminins exist in wheat, rye, and barley, and there is a discussion about oats. In wheat, the protein is called gliadin, in rye it's called scallion, and in barley it's called bordion. So there is this debate about oats. People do say that oats can cause an inflammatory response in individuals with celiac disease. However, it is proven that oats do not contain gluten themselves. However, they are most often milled in facilities where wheat is also milled. There is this high potential for contamination, which then can cause this dietary immune response. And people with celiac disease experience symptoms when they have oats, but if they can ensure that oats are gluten-free or they were not contaminated with wheat, then they should be fine. So how prevalent is celiac disease? Currently, we know that 1% of the American population and 1% of the European population are diagnosed with celiac disease. It is more prevalent in women than in men. However, an interesting fact is that 10 to 15% of the people diagnosed with celiac disease are treated. Recent statistics say that 1 in every 200 to 500 people have celiac disease. But another startling statistic, though, is that only 1 in every 4,700 have been accurately diagnosed. This leads us to our iceberg model, and this iceberg model reflects that celiac disease is more common than people think. However, as I will talk about later, it is not accurately diagnosed, and it is not accurately screened. So if you look at this picture in the middle of the screen, at the tip of the iceberg represents patients with clinically diagnosed celiac disease. Then right under that waterline is the patients that are undiagnosed with celiac disease because their symptoms aren't prominent. And then lastly, there are patients with latent celiac disease, and this means they might have a genetic predisposition, but their symptoms have not arisen, or they haven't gotten tested. So let's talk about celiac disease and what happens inside the body with celiac disease. So when you eat gluten, it causes this immune reaction that causes an inflammatory response that directly affects the small intestines. Body views gluten as a toxin, so when you ingest it, it causes a release of antibodies to destroy the gluten. However, because it is an autoimmune disease, it also attacks the body as well. It attacks itself. This is classic of an autoimmune disease. Because these antibodies are trying to attack the gluten and also attack the body, it causes a lot of damage to the microvilli inside the small intestines. Here is a picture of the entire digestional tract. So as we eat food, it goes down into our esophagus, processes in our stomach, goes through our small intestines, and right here is where the majority of celiac disease, all that damage occurs. So the body attacks itself, and it causes the microvilli in the small intestine to become damaged, inflamed, and it also leads them to flatten. If we look at the schematic to the left, we see on the left there is a normal gut with the microvilli. They're nice and long, tall, and finger-like. And then with celiac disease, they flatten, they lose that surface area, which affects the absorption of nutrients in the body, which is the primary detrimental effects of celiac disease. The damaged small intestine leads to other problems as well. It can lead to electrolyte imbalances, which is critical for athletes, but it can also affect cardiac arrhythmias. With a lot of damage to the small intestine, this requires a lot of healing time because the damage is extremely significant. Celiac disease has two mechanisms of development. The first one, there is a highly genetic component where an individual must possess specific alleles in order to get the disease. And then on the other hand of the coin is the ingestion and exposure to gluten during infancy, where a baby is exposed to gluten diet that can cause this development of celiac disease if they have these specific alleles present. Again, it is usually onset in early infancy and childhood. However, the prevalency in young adults and older adults is becoming more common in the last 10 to 20 years. So let's talk about the genetic components of celiac disease. In order for an individual to develop celiac disease, they must have a genetic predisposition. They must possess the specific human leukocyte antigens, or HLAs, DQ2 and DQ8. 30% of the population possess this allele. However, not every single person develops celiac disease if they possess these different alleles. So it goes hand in hand with the second component of developing it. So just because you have these alleles or these genes doesn't necessarily mean you're going to get celiac disease. It also goes back to the ingestion of gluten and other modifying factors. So you can develop celiac disease if you have these alleles, or if you had formula feeding or the duration of breastfeeding could have affected how you develop celiac disease. The method of birth, either vaginal or cesarean, could affect if you get celiac disease. The timing of the introduction of gluten in the diet, when you were born, during the year, if you had any infections during your childhood, and then more importantly, if you have any family history of any autoimmune diseases, will put you at a higher risk for developing celiac disease. And these are like type 1 diabetes and thyroid disease. So with celiac disease, there are many signs and symptoms where you can diagnose celiac disease. There are a lot of nutritional deficiency people will experience because of this lack of absorption of nutrients, because of the damage to the small intestine. There are also a lot of neurological symptoms that people can watch out for. And then most importantly, there are digestive systems, and those are the most obvious. In regards to nutritional deficiency, people with celiac disease, more often than not, will have an iron deficiency anemia, which means they're not having enough iron in their diet because they're not able to absorb it. They'll also have a protein calorie malnutrition. This is really important for athletes or anybody who's trying to be physically active. Make sure they're getting enough protein. And then there's also the mineral and fat-soluble vitamin deficiency, such as zinc, folic acid, selenium, vitamins B6, B12, D, E, and K. In addition, there's a lot of neurological symptoms that go along with celiac disease, such as headaches, seizures, anxiety, depression, schizophrenia, and peripheral neuropathy. And then lastly, there are a slew of these digestive system symptoms that are more common, and these really help people detect whether they have celiac disease, and this includes bloating or the feeling of fullness or swelling in the abdomen. Chronic diarrhea is a common symptom. Constipation, gas, nausea, stomach pain, and vomiting. And again, more of these digestive system are more common in children, and it's not as prevalent in adults. So it makes it harder that if you are adult and you are developing celiac disease, it makes it harder for you to diagnose yourself. Here are other symptoms that occur mostly in adults, such as anemia, which we talked about, a red, smooth, shiny tongue, bone and joint pain, which is very critical, dermatitis, herpetiformis, which is a skin rash that develops with the ingestion of gluten. In females, they could experience infertility or repeated miscarriages, as well as missed menstrual periods. Mouth problems such as canker sores and dry mouth can arise. Tiredness is a predominant feature of celiac disease, and then weak and brittle bones. So dermatitis herpetiformis is a common symptom of celiac disease. It's classified as itchy, blistering skin rash. It immediately develops after the consumption of gluten. However, it relieves with a gluten-free diet, which I'll talk about later. Medicine can relieve the symptoms of the skin rash, such as Dazepone, but it does have some drastic side effects. but it does not treat the overall causes of celiac disease. It only treats the skin condition. So the small intestines is still being affected and still being damaged. In addition, in children, it can lead to developmental problems, such as the permanent damage to teeth enamel. It can lead to delayed puberty, failure to thrive in infants, mood changes or feeling of annoyed or impatient, slowed growth and shortened height, and weight loss. So how do we test if an individual has celiac disease? The most prominent way to do this is genetic screening through serologic antibody tests or blood tests. In addition, there's endoscopic intestinal biopsy tests. This is something that you would do if you had all these signs and symptoms that I was talking about, and if you were positive for genetic tests. And then lastly, but not as common, are skin biopsies, and you would go get a skin biopsy if you are suspected to have this dermatitis herpetiformis that occurs on your skin, which is a reaction to glucose and gluten. Currently, there are no medicines or medications that do treat celiac disease. The primary treatment for celiac disease is adapting a gluten-free diet. This consists of avoiding all gluten, so no grains, no wheats, no pastas, no breads, and eating more naturally gluten-free foods, such as fruit and vegetables, meat, poultry, fish, beans, legumes, and most dairy products are gluten-free. However, when you eat a gluten-free diet, it's not just about eating vegetables, it's also about educating yourself, and this is really important when you're walking in the grocery aisles to pay attention to food labelings. Currently, the FDA defines gluten-free as any term with gluten-free, no gluten, or free of gluten, or without gluten. If they have that on the label, they must meet all of the definitions requirement, so there is no contamination, and people with celiac disease will not suffer. But following a gluten-free diet doesn't mean that you have to give up all your favorite foods. It just means you need to find grain-free alternatives such as meal flour, coconut flour, corn, quinoa. And many people have reported that they have alleviated most of their symptoms by eating this clean diet without any gluten, and they experience less fatigue, more energy, a lot of their headaches subside, and they also have a decrease in their iron deficiency because they're able to heal that the inside of their small intestines, and they're able to improve their absorption. So let's talk about celiac disease and exercise. Currently, there are no recommendations by the ACSM for people who have celiac disease and how they should exercise, but through research, I have found that people who have celiac disease should be treated like normal healthy individuals, but only do things as tolerated. Athletes, it is a huge issue with them in exercising because they have issues with iron and calcium absorption, and this affects performance as well as bone health. However, for everyone with celiac disease, they should focus on strengthening their bones through resistance training and also helping combat the symptoms of celiac disease, which exercise can help. For my case study, I have a 28-year-old female with a blood pressure of 144/82, resting heart rate is 74 beats per minute, her HDL is 42 milligrams per deciliter, and a resting blood glucose of 88 milligrams per deciliter. Her BMI is 25. She reports an onset of bloating, crampiness, and diarrhea, and reports a lack of energy and mild joint pain. She was diagnosed with celiac disease 3 months ago. Overall, her lifestyle is very sedentary. She has a 45 commute to work every day and works at a desk. But she says that she likes to hike and walk her dog, but recently hasn't had the energy to do so. So she is suffering from celiac disease, but she also has high blood pressure, which is being treated with medication, and she is borderline obese. This can be due to her sedentary lifestyle. So goals that we have set up is walking up the stairs without fatigue, being able to walk her dog at least twice a day, and having energy at the end of the day, and then also losing weight. So according to the ACSM guidelines, I would be treating her for her hypotension and obesity. So she should perform aerobic exercise 3 to 7 days a week at a moderate RPE, greater than 30 minutes a day. She should participate in resistance exercise 2 to 3 days non-consecutively at 60 to 70% of her 1RM for 2 to 4 sets of 8 to 12 reps. And then flexibility training should occur at least 2 to 3 days a week, with stretching to the point of feeling tight, holding static stretches for 10 to 30 seconds. Exercise modifications should be modified appropriately to the individual and adjust the training days, time, and intensity based off of fatigue levels.